Alison, thank you so
I
much for all of your input. And if I may add, what we as a FSOMA trying to do to help our Florida schools and what we as a profession can do to try to help our schools. So as a FSOMA, we are currently working on the projects on the governmental level, exactly like Alison said. It starts with obtaining a designation for acupuncture as essential benefit status in the state of Florida. Currently, only 6 states have that designation. We are working with CMS to obtain that status, which means that it's harder for insurances to deny any payment for acupuncture services because of that status. In other governmental activity, which we are doing, we are planning to meet with legislators, with ACA, to make sure that acupuncture is included in the budgeting for such programs as Medicaid. And though Florida state managed Medicaid does not cover acupuncture, and this is not a large percentage, and this is not a clientele which we are fighting for. But what we want to make sure which gets supported is private insurance companies who manage Medicaid do pay for acupuncture. They currently do, it just low rates. But I was just researching very recently what are rates for next year, and let's say like workers' comp increased their rates very significantly. It's almost 30% increase. It's unbelievable. It's more than we charge in cash practice. So we want to make sure that the government considers those rates for private insurance Medicaid programs. Accordingly, all of the private insurances will be more inclined to increase the rates for insurance reimbursement. Accordingly, we as a FSOMA working on putting more educational programs for our already licensed acupuncturists how to correctly bill insurance and reduce rate of the claim denials. We are providing constant updates on what is going on in the world of insurance. And the most favorite pet project, we are working on the program to help our colleges to accept insurance, which also will provide so necessary piece of education for our student acupuncturist, first of all, to learn how to do it correctly, and for our colleges have a better survival rate and being prepared to release the product which can be employed by any institution. So another project as well, which we are working at the FSOMA, we are creating a packet for MDs how to more properly refer to acupuncture, since it is a Florida state mandate. Every MD, before prescribing opioids, must give the booklet to the patient, which suggests non-pharmacologic therapies, acupuncture being number one of those. So we working on informational piece which will tell MDs which insurances are paying for acupuncture, how many sessions, which diagnosis, and the most important, how to find an acupuncturist, because that's information which is missing right now. So as a FASOMA, we are about to bring a new website on, and that website will have a SEO optimization search engine for Google, which also will put our acupuncturefla.com page up. This is a page which is designed for the public, telling about acupuncture and all adjacent techniques, and obviously how to find the qualified practitioner. All this insurance information also will be available for our Florida, for FSOMA members, and each school now automatically enrolls all of the students being a member. You just need to make sure that you go in on the FSOMA website and join as a member, indicating which Florida school you are with. You don't have to pay. Our schools are unbelievably great. They all provide it for you for free. Our schools are really probably the best in the country. We need to give them credit for that. So, in a last sentence before answering to questions, which I would like to say is what our licensed practitioners can do: employ our graduates. It's not necessary, has to be right away full-time position with benefits and with everything else. At least PRN. If each practice employs a student at least for one day, and the neighboring practice employs for another day, and another neighboring practice employs for the third day, we will provide for our students employment, but it has to be employment. PRN means on as needed basis. It's non-benefit position, but it documents employment. And those students who got employed, please report back to your school that you did obtain employment. It's tremendously important because the school has no means to know that you are employed if you don't tell them that you did got employed. Okay, so how you see, we are working very, very diligently, and all help appreciated. FSOMA always looking for the volunteers. How Alison said, please participate in social media. Please brag about acupuncture. Please brag about FSOMA. Please brag about your experience in the school. It's very important. All righty, thank you so much.
I want to say a couple of things too. We have Building Better Business webinars. Some of them, are older, may not be that great. David Bibby did a great one on starting a practice. So if you're starting out, that's a great one to go in and look at. We have other ones in there. They're organized by topic and title. Nationally, FSOMA supports the ASA in its work to get us into Medicare, which is pretty vital for us to be on the table and able to be employed. So just wanted to add that in as well. So there is a question in the chat about what's FSOMA doing to prevent other providers from being able to do acupuncture, like physical therapists and chiropractors with dry needling. So do you want me to answer that, Galina, or do you want to?
Unfortunately, defense in modern world doesn't pay off. We can be in defensive mode and spend huge amount of money, all what we want, but unfortunately we will not go anywhere, because we can win the statute change, which FSOMA successfully did in the past with the PTs, but unfortunately they can turn right back next year and pass it through the rule, which we have no influence on. The best
we beat them in a court case. Yeah. And but then they went and changed their statute, and yeah.
So the best way how to do that is in offense. It's one of the big reasons why FSOMA is working right now on changing our Florida statutes, which will include, we pray for that, yes, we work for that, and please join us, visit legislators, ask them support 457 changes. We are asking for direct supervision, and what it means. If we have a direct supervision, and especially with doctorate degree, we might be able to supervise those professions who don't have direct access to the student, or excuse me, to the patient. That's one of the ways to do that, because we are the most educated professional. Because do you know or not, but right now in hospitals, we are credentialed as allied personnel. Allied personnel requires a supervision from MD. And it's hospitals. It has nothing to do with your state scope of practice. It has to do with credentialing and privileging in the hospitals, which is completely different animal. But this has been an obstacle to practice, because very many hospital administrators or integrative medicine physician or other department physicians, like for example, oncology departments, are interested to have an acupuncturist on staff, but they don't know how to supervise us, how to credential us, and so forth. NCCOM has developed a great package designed for hospital administrator, which talks about how to credential an acupuncturist in a hospital. We will post that on the FSOMA website, and please make sure that you are all Ellen, if you can take a roster, and we will try to send the link to that package, and we also will put that in the newsletter for acupuncturists, the credentialing. If you know someone in a hospital or integrative practice, you can print out that sample credentialing and bring that to administrator who doesn't know how to bring you in the hospital. So that's at least some of those things which we are doing. And obviously, please, 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 again, go on our website and support Medicare. It does not match how Medicare pay. And by the way, they don't pay that little, not at all. So 2 units of acupuncture by Medicaid roster is up almost $88. Hey, it's almost cash rate in Florida. The problem is the physician supervision. So we need to obtain the rights to be a social security providers. And what it means employment. The most important, it means employment. It's why we so need to be politically active, not only in the state level, but in federal level as well. FSOMA every year represents Florida on the Hill in Washington, D.C. We go, we visit our legislators, we advocate, and if you are interested to be a part of this effort, please make sure that you are members of the FSOMA. You contact in Ellen, and we will provide for you all of the information how to do that. Thank you. So I don't see any more questions which I could answer. And by the way, in VA hospital models, it's not correct that they are not supervised by MD. It depends on the level of education. Those who have a master's degree must be supervised. Those who have the AOM are not. It's why we're talking about doctorate degree, exactly for that very same reason. It's a very different pay scale. It's very different. It also can change from hospital to hospital, state to state. But the general agreement is that the doctorate degree usually are credentialed in the hospital as staff positions, which are unsupervised position. And if it's master's degree, it is allied health, it is supervised position. So. Any more questions?
I'm answering. Yeah, I see one about insurance, and I'm typing an answer, but I'm going to say it. It was about a comprehensive seminar or classes in South Florida to be an effective medical biller. And there's no such thing. as a class for acupuncturists for that. Sam Collins from the AAC and Maury West offer classes on billing. You can learn a lot. It is such a complex thing. Each insurance plan, you can have the same insurance company, but there's 5 different employers that have a Blue Cross plan, and they're totally different. So it's just a crazy system. So, you can take classes from Sam Collins at AAC and Maury West and take several of them and get a pretty good understanding. But we pretty much recommend you hire a medical insurance biller, interview them, and hire a biller to help you with your things. It's not a bad idea, even if you're hiring a biller, to know something about it, but comprehensive is a wiggly animal. There's just so many different things that go on with billing. A sealed transcript. When I had to get transcripts sent, this was years ago, I had to have it sent from the school to the Board of Acupuncture. I don't know if you can do it. You can try it. It's hard to get an answer from them, but you can try sending it and see if they will. But generally it has to be sent from the program. And if your school's closed, it's the Department of Education in the state that would have it and send it. I'm not sure what DTCM means. What about those with DTCM?
That is entry-level doctorate. Yes, that should apply to
Okay.
entry-level doctorate as well.
Okay.
So one of the
Okay.
things which I can add about insurance, please look at the insurance forum on the FSOMA webpage. We post webinars as well, which I taught at 2022 about medical records and documentation at the FSOMA conference. Amy Sear teaches regular classes on documentation. Next year, we will be producing much more classes on the documentation, and my textbook on documentation is coming out. The billing. Let us try to imagine for a minute. Biller is a separate profession. Why do we think we should take on separate profession? It's exactly the same question like chiropractor is trying to do dry needling without having proper education. The best way to deal with that, outsource to specialists. So it's not more than 10% of what insurance pays to you, not what you bill, but what you get paid. They do your credentialing. They will verify does patient have coverage or not. They know all ins and ends. They will help you with following on every year changing codes. Believe me, it's very expensive to take the class on insurance every year. Yes, and you still don't have time and a sufficient amount of knowledge of doing it. Hiring professional biller, that is the way to go. Have you seen a single MD doing billing themselves? Hello, we are in exactly the same separate healthcare profession. What we need to know is really how to write the documentation, how to support our treatment in diagnosis. That's what is important. And remember that our pretty much our SOAP note is an itemized receipt for what we bill to insurance. Everything what we bill have to be supported by the note. That's what is our duty and responsibility. So as with every law, here is a question. Also, if LAC become a mandatory doctorate program, will LAC become grandfathered in? As with every law, usually it's effective the date going forward, not backwards. So that's one of the things. And for right now, we have postponed the wish for doctorate degree on our proposed statutes, just because our schools right now, right this time with all this gainful employment, are in such of the pickle. So it's much greater priority for us to make sure that schools can properly function, schools can earn money, schools can provide the great education. We shall, as a profession, focus on providing an employment for our graduates, and we will revision that proposition later. And we, as a FSOMA, how I said, developing all of the package of documentation to disseminate to all medical professions as private practices, of, especially integrative practices, as hospitals, to make sure that we generate employment for our graduates.
I see a question about larger associations that include natural doctors, acupuncturists, chiropractors, et cetera. There's never been a large association. Over the years, there have been groups that come together, different professions that join together over an issue, but there's too much turf to protect. As you know, chiropractors are now doing dry needling. And, you know, if we had every acupuncturist in the state as a member, we might be able to have some impact, but we don't. Chiropractors have 8 people on staff in their office. They have 3 or 4 lobbyists working for them. So, you know, part of it is joining together, you know, supporting your professional association. If you don't like what your professional association is doing, join the board and get them to do what you think they should do. But, you know, we're working for the profession, and we're doing what we can with the resources we have to do the best job for the profession. And I think what we're focusing on now is building ourselves up and promoting ourselves. We've got several advocacy programs going, exhibiting at a big health fair in Ocala. We've gotten on the radio in South Florida. So, you know, let's just keep promoting ourselves. But there have been small associations that have come together. I think more important would be to start a patient campaign for better insurance coverage and better acupuncture coverage, and get patients involved rather than join with other professionals, because the patients are the ones that suffer. So the Medicare, if your patient is on federally managed Medicare, you have to have an MD in your office supervise your treatments. If your patient is on an Advantage plan, which means an insurance company manages their Medicare, then most of them have insurance coverage, and you don't have to have supervision. But again, it depends on that plan, because all of them are different, and even the part of the state can be different that you're in. So it's confusing.
So answering the question, which I see, the MD OBGYN I work does his own billing. So it's not an MD who does billing. It's most likely a biller in his office who does the job, who has at least some type of education. It might be anywhere from 1 year to 2 years program. And that's what's likely what is happening. Believe me, there is so many caveats in the insurance. That amount of money which you losing and not being able to follow on the claims, we hear it in insurance committee all the time. That insurance biller has pretty much is absolutely necessary part. Of course, if you maintain a very large practice and you can hire a person who will do part of the job of your office manager and part of the job of insurance biller, it's possible. But if it's a small practice, you know, just talking from my own experience, it saved for me so much time and money. And, you know, the funny thing, my insurance biller even helped me to sell the practice, and I was moving from Florida to Ohio to work for Cleveland Clinic. It was not a broker; it was my insurance biller. Yeah, and amount of guidance and advices which I received, I cherish to this day. I was privileged to be audited internally while working at the Cleveland Clinic. And let me tell you, those insurance billers are a tremendous help. They definitely save for you false claims, fraudulent claims, money loss, um, claim recoupment, and all that, because they follow on that as quickly as possible, since this is their bread and butter. And we are should be focusing on our clinical science, not on administration. Your time costs much more than the biller time. So rather market and obtain another patient versus doing the job which we really don't have a lot of education to do. So that would be just my advice. So guidance for the success of acupuncture graduates.
I typed an answer to that. If you want to speak to it, do,
Yes,
but I
I would
typed an
love to
answer.
speak to that, because that is one of those interesting questions. You know, I lived in 4 different countries. So in 4 different countries, I had to make it. Then I moved to United States. My previous education was not translated. I had to go back to college, pay. I graduated from East West, pay the tuition and everything else. One of the things which I learned in my journey in 4 countries: believe in yourself, do not pay attention to obstacles, and see the goal, have a vision, and work toward it. That is one of the most important ones. Knock on the established practitioners' doors. Prove to them that it's worth to hire for you, especially when you just graduated, just started licensing. Even before a license, knock on their doors. Ask to be a receptionist. Ask to work on the front desk, for you would learn the science of business. And then you graduate. Again, how I said, knock on everybody's door. Hire me for one day. That's probably one of the most important features what you can do as a new graduate.
Okay, I've answered a question from Marta. Please email us about being involved in legislation issues. We have a campaign going to visit your legislator. David Bibby runs a legislative committee. We'd be happy to have you on it. So yes, email us, connect with us. There's a place on the website to look at committees and find out a little more about them. Dr. Wilson, there's a question for you about Vanessa Jubas graduated from AMC last month. If she wants to attend Adam's doctorate program, will AMC still send over the transcripts? Or will she? I know the state sometimes takes that over at some point, but do you know the answer to that?
I don't know the answer to that, but I'm in contact with them right now. So I think if you would contact them now, they would certainly still do it. I know Carmen and Christy are still there working, so I think you could perhaps send that to them. I know they've been sending me transcripts on for other things. So if you're really interested in that, then I would suggest here in the next week or so that you get hold of them and have that sent to us so we have it on file. I believe for all of you who are graduates, and Christy can answer this for you, but the normal thing in Florida is the records go to the state. I will have records on current students, but past students, I think your records will all be at the state. You would be able to get it sent from them, but that could be slow. So my suggestion is if you're thinking about it at all, just have them send it to us now.
And there's a question in the Q&A, Galina, if you would read it. It's a long one. It's about insurance, so.
So this is a very specific question. We do have a 2 members two professional insurance billers as our business members. One is Lori Schaffer Company. You can find her information on FSOMA website. She's also on our insurance committee, very knowledgeable. So I would suggest for you to use the professional insurance biller for that, because it's way too specific. I cannot answer it without knowing more details, and this is not a public knowledge. And another one, I believe, is Sticking to the Point, or what is the name of another insurance?
It's To the Point.
To the Point.
To the Point.
Yes.
And they do answer, Lauren and one other company, can't remember right now, do answer questions from members. They won't do your billing for you for free, but they will answer questions. So Susanna, if you're a member, you can go in and you shoot me an email and we'll get it to them to get an answer. But yeah, you sometimes out of network you get more money than if you're in network. So I'm not sure about anything else, but yeah.
Allison, are you still there? I lost your picture.
I'm still here. It's just I'm on a phone call. We're not doing it back.
Okay, Allison, here is a question for you. Are you able to talk about the doctor's program, please, the hours, and is it suitable for full-time workers?
Okay, that I can talk about. So the DAOM program is set up with the idea that the majority of the students in it will be people who are practicing. You don't have to be. You could be straight out of your master's or your professional doctorate program, but a lot of them are out and practicing. So it's very different than master's. It meets one long weekend a month, a Friday, Saturday, Sunday, Monday, once a month. It's a clinical doctorate, so there are clinical things attached to it, but those can be done on your own schedule outside of that month each quarter. So although it takes a commitment of time away from your practice, very doable if you are already working.
Thank you.
So there are also options, though none of Florida colleges offer it yet. It's not an advanced degree of DOM. It's DAHC, which is an entry-level doctorate. If you already have a master's degree, this is so-called completion track, and that one can be done online. So
Galina, let me add about that these are two entirely different degrees.
yes.
That completion degree is basically the professional doctorate. So it's upgrading your master's, an entry-level degree, to the newer doctoral entry-level degree. The DAOM is a postgraduate doctoral degree that you have to have either the master's or the professional doctorate in place before you can enter. So they are different degrees.
Yes, they're definitely different, and definitely DAOM adds much more value to that. It's probably at the level of PhD, just a clinical instead of theoretic. So, but that is that level program. Are you seeing career path trends of acupuncturists as of recent? One of the things which I can add, that looking at the current economy, I would say that we all definitely need to learn how to play an insurance game and bill insurance. And how I said, I was so surprised looking at next year workers' comp. 2 units of acupuncture, if it's just non-electric acupuncture, can cost about $120. And electric acupuncture cost goes to $147. That is workers' comp. It's legislation mandated lower level insurance company. So they are actually coming around, what is very, very interesting. And if you look at EM codes altogether, they're higher than our cash prices. We need just to make sure that we're learning how correctly play the game. And remember, it's the game. Yes, if you're playing it, you're in. If you're not playing, there is plenty of other players like chiropractors and everybody else who are already in and know how to play. So we will be focusing as a FSOMA next year so much more on how to do it. So keep your eyes open for our classes. The rates which I was talking, workers' comp, it's always a state established program. Then you're looking at federal, your guidance would be Medicare. Medicare have not posted the rates for next year yet.
Somebody is asking about the Florida growth. I don't think it has to do with the Florida growth, but the Florida demographics. You have a lot of older people that retire here, have some disposable income, and are interested in their health. And I think that's one reason we possibly make a little better living in Florida. Overall, I think the trend has remained that we're mostly single practitioner practices, or in a group agency with either other APs or DCs. I've been hearing more people getting jobs in some of the big medical centers and in the VA. So I feel like there's some incremental growth in there. But to protect that, we really need to get in Medicare because they don't know how to get us paid. And if we could be paid by Medicaid, Medicare, they would hire us in a heartbeat. So that's something.
The big caveat with Medicare is right now we are employed only in outpatient setting. And hospitals may or may not bill insurances, but it's always outpatient. Those rare practitioners who work inpatient are usually working on the base of the grant by very simple reason. The inpatient hospital cannot offer any services which is not paid by Medicare. And if hospitals will try to bill for us as incident to the physician services, which is mandates right now, they have to have an MD standing over your neck, which creates the service absolutely financially impossible for them. So it's why, how I said, I worked for Cleveland Clinic. Cleveland Clinic said that they will not accept Medicare because it completely screws up their billing system. So for acupuncture.
Yeah. One other point about growth, pretty much the number of active licensed acupuncturists in Florida is the same as it was 10 years ago. We have not grown as a profession. There's been a huge amount of attrition. COVID, I think, had a big hit. I think if I don't remember the numbers, but I think we were getting close to 2,800 to 3,000 around 2020, and now we're back to 2,500, 2,600, which is when I took over as executive director was the number in Florida. So, we're in trouble. We really need to get some more action going and some more help for practitioners to make a living. Insurance, getting into the medical system as a provider is all very important. So we're at 8 o'clock and I don't see any other questions. Give us a call. We're here for you. And we do, find support for you. I put an example in the chat, but, it's, call us. We can find support for an issue. We can give you encouragement. I can hook you up with somebody local that may mentor. We don't have a mentoring program, but I do have APs that have said they'd be happy to help new practitioners. And so So glad
And
you're
one
here.
last question, Ellen. Sorry, I will try to engage Dr. Wilson on that as well. Any recommendations for looking for grants to help write for our acupuncture schools? And that subject, I really don't know. Alison, is there any recommendations on that?
So it's hard for us to fit in. A lot of them out there are for nursing and things like that. It's harder for us to fit in. There are some out there. And the other thing is NIH currently has studies going on. They have a whole department for TCM and acupuncture, and they have studies going on, and there are grants there. The hard part for most acupuncture schools is NIH gives grants to DAOM, not to master's level. They will sometimes grant it to a school that's just master's level or professional doctorate if they can be associated with an MD, a hospital, something like that. Those are the things that kind of, or we're working on one right now. Don't know if it's going to go through. It's going to be approved in a joint research project with one of the universities with our master's level. So they're out there, but they are not so easy to find. But there are some state grants out there. There's some government grants out there for small schools, and as we're really categorized, technical schools. They're out there, but you really have to go out and look for them.
So thank you all, guys, so much. We appreciate a lot. Thank you, Dr. Wilson, for joining us and providing information for all. We greatly appreciate. And thank you all, and we will adjourn on that.
Okay.
Thank you, guys.
Thank you all for coming. Email me if you have questions.
Bye-bye.